Good afternoon, everybody. I'll be talking about a pocket-friendly stencil for all, diagram. So the problem statement here was, as we all know, documentation is the cornerstone of clinical science. It's a lost art now, rarely practiced now. And most find it time consuming. It's very prevalent amongst juniors and senior clinicians. Mainly, this helps us to document the pathology in a more detailed manner as compared to a clinical photograph. So why is documentation really necessary? Is it necessary? Yes, it is. It's a standard clinical practice worldwide. Follow-up is possible only if you can compare it with previous records, will help you medico-legally, important for resident training, teaching, and during the examination, allows you to accurately describe the size, depth, and location of the lesion. Last but not the least, unless you're documenting it, you have probably not even seen it correctly. Do you really know what break you are actually seeing, which clock hour it is in? Unless you document it, you're not really sure what you've seen is correct. So what we are using nowadays are these stencils which don't have the proper ophthalmic diagrams, the bangles, and the compass that all students are using in examinations. So the current problem is time consuming. It doesn't justify the standard ophthalmic diagrams. Slit cornea views, anterior chamber angle documentation is not achieved. So that's when I came up with this prototype. We did a 3D printing and we came up with these designs which would be very helpful. This is pocket friendly in a keychain manner, showing most of the important diagrams that we need for documentation. So the uses and applications. So this is for the cornea, wherein the slit and the whole cornea slit and front view can be documented. This is for the squint evaluation and oculoplasty related evaluation. It's for angle of anterior chamber related. This is for ROP zones documentation. This is the cross for the retinoscopy and also can be used for gonioscopy. These are the pupil diameters on the side ranging from 1 to 10. And these were the basic prototypes that we have come up with, which is pocket friendly. And this for retina. So would want to come up with a more foldable stencil type of prototype, introduce more designs which can be specific for any disease, like for a corneal ulcer, come up with shapes and size showing DM folds or probably edema and epithelial defect. So it's a pocket-friendly, essential documentation tool for resident training, essential exam tool for ROP training and screening, and a follow-up tool. Thank you.
I have a question about your this one for the squint. How do you do this?
No. It's
How will
just
it work?
just to show a basic exotropia in like just for examination while writing
Just
for
to draw the eye.
yeah.
Just to draw the
Yes.
palpebral aperture.
Yes. I'm not saying all of it is necessary, most of it is, but because we are making designs, we try to make more designs for all the different specialities.
I think, but it needs a lot more
improve.
refinement.
Yes. This is a very basic, I've not even brought
this
it out.
is
It's
but
a very
it's
basic.
a good idea.
Yeah.
It's a good idea, especially for residents.
Yes.
I would recommend that they use it, particularly the one where you showed the ROP zone.
Yes, exactly.
That is very good.
Yes.
Could have a cornea.
But don't you think having these pictures ready-made on a case sheet
So
is less time consuming as compared to
that's true, sir. First of all, not everybody has the accessibility to EMR. We are still talking about medical colleges where they are still doing paperwork. And also, as resident, I feel it is important that we learn the diagrams first and not directly jump into pictures, because documentation of every sign is very important to learn it. Even for examination, we are not going to take a picture along with us. So even for follow-ups, if we can show the size of the epithelial defect decreasing, and if we keep doing it, the reason they are not doing it because they don't have a tool which is helping them. They will be like, why it's so time consuming? But if we have something in their pockets where they can do it regularly in the OPD while they are seeing a patient, I think it would be great.
Yeah, I do accept for residents it's fine.
Yeah.
But as a process of documentation, I think it makes more sense to have these
Photographs.
diagrams so that it's less time consuming and much more easier.
But I think I agree with you that for the beginners, for residents, this is a very good tool to
Yes.
get them used to documentation. You know,
Yes,
they can
ma'am.
take pictures later on, but in the beginning, let them at least.
Yeah, I think that's a learning step. I mean,
Yeah,
we cannot directly jump into
absolutely.
slit lamp photographs, and not everybody has a nice
Has
slit lamp
access to all those
photography.
tools.
Yes.
Right. Good. Good.
Thank
You
you.
could include a corneal section in this
Yeah.
Okay.
also. That's
Yeah,
missing.
yeah. The slit. Yeah.
Yeah.
Yeah, the best way to learn is to draw. So
Yes.
yes, that helps, but you get printed sheets also.
Yeah, so we do have, but I'm just saying for examination also. I mean, if you have something which can be used everywhere, printed sheet or something, then again you go and
It's a
take a
good
set of-
idea. It's
Yeah.
Yes.
a very good
It's
idea.
an
The
alternative.
more
I'm not saying it's not
yeah,
there.
the more
out,
you
but
draw, the more you observe, the more you learn.
Yeah.
Yeah.
Very nice
absolutely.
uh,
The